My Child with a Disorder by Elliot Rogers. Okay. First off, we have the doctor's report. This shows the age, the sex, symptoms, all this. And then some treatment options that you have. In the doctor's note, we have statistics of who and how common it is to get hemophilia. There is the medical factors, including treatment and genetic therapy. And then assistance. These are things to help you out with your kid if they have hemophilia. And the doctor's note, this is the research. And basically the sum of it is that hemophilia is a disease that, it's an X chromosome disease, and it is caused by a genetic mutation, and most severe hemophilia cases are mostly men, and then the most mild cases are mostly women. Genetic counseling report. Genetic counseling report, I have the inherited traits, how it is inherited from the mother and father, including the X-link. It is a recessive mutation that comes from the F8 and F9 gene. This is a diagram of how the genotypes of the parents can pass it down. Yeah. Okay. Genetic counselor report. Basically, this entire slide shows that if this is situation 1, if the mother is a carrier and a father is unaffected, and it shows the statistics of who will have hemophilia. This is number 2. The father has hemophilia, the mother is not. All sons will be unaffected. All daughters will be carriers. And then this is the last one, father 3. 3 has hemophilia, mother is not a carrier. Each son has 50% chance of having hemophilia. Each daughter has a 50% chance of being a carrier and a 50% chance of having hemophilia if both X chromosomes are effective. Okay, in the parent report, this is basically the part where I sum up what I would do if me and my wife had a kid that had hemophilia. And I'm not going to read all this, but the gist of it is I'm a work-at-home dad, and while my wife is out, I take care of the kid. And the real difficulties of having a son or daughter with hemophilia is injuries, because hemophilia causes the body to have uncontrollable bleeding. So small injuries can have big causes. Or small causes can have big effects. I explain in this how I would explain to the places he's around, like his school and anywhere that he's around, that has hemophilia and he needs to be treated with extra precaution. And that's basically the gist of this. And the second part, this is basically just a little. This is actually the end of what I was writing down the last slide, and this just still, this is the what if I had a son that had hemophilia, and in this I just explain that if I did, then I would think it'd be better to move to a I know because I've researched it. It is better to move to a hospital, and I would move to the hospital with the best rates in town because I would care about my son a lot. This is the community resources. So this just is local treatment center. This is the Johns Hopkins Hospital. This is a hospital in Maryland that offers treatment to hemophilia patients and other bleeding disorders. This is the one of two biggest ones in the U.S. And the local support groups. Uh, the Hemophilia Federation of America. This is a very popular federation that supports not only families with hemophilia, but any other bleeding disorders. The Federal Hemophilia Federation of America, aka HFA, offers education resources, community events, advocating programs, much more. It can involve itself in sometimes expenses can be a lot. It helps out with really anything that has to do with it. This is the National Hemophilia Foundation. This is another foundation that supports all bleeding disorders and is dedicated to find cures. This is one of the biggest organizations finding a cure for hemophilia because currently there is no cure. Community resources. There's no specific hemophilia school. The HTC team teams up with your school, sets up a plan for your child to ensure his safety at school. And in the support, the FHA or the HFA provides a number of financial assistance, and the HFA is basically the Hemophilia Foundation of America, which, like I talked about before, this support is really just really good for people who can't afford to treat themselves, their sons, their daughters, their wife, anybody with hemophilia. These are my sites. I'm going to turn this in so you can look at all these. And that is my presentation. Thank you for watching.